This is the Emergency Medical Minute.
So I looked into the effects of ketamine on the geriatric population. There's a recent study in Journal of Emergency Medicine that compared a dose of morphine, 0.1 milligrams per kilo, to ketamine at 0.3 milligrams per kilo. Blinded study, 30 patients in each arm, and then looked at the efficacy of pain relief and side effects. As it turns out, ketamine was a little more effective at 15 minutes, so they followed it out at 30, 60, 90, 120 minutes. But ketamine had significantly more side effects compared to morphine in the geriatric population. 60% of the patient experienced dizziness, 50% described an uneasy feeling, and a smaller percentage had frank hallucinosis. The study actually lacked power to be statistically significant. They'd probably have to have 45 patients in each arm. But the implication was that at that dose of 0.3 per kilo, probably too heavy for the geriatric population, and the dosing rate was over 15 minutes. Do you know what our dose is for ketamine when we order it in a single dose fashion? It's 0.2. So better dosing, but the authors actually recommend going to 0.1 milligrams per kilo and doing it over a prolonged time period, like 30 minutes instead of 15. So after experiencing that with my patient last week and seeing how uncomfortable he was in that setting, although it did help his pain, I'm going to be backing off on my dose. Even though the preset order form is 0.2, I'm going to ask for 0.1 and go slower. It's always easier to put more in than suck it out.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.